Welcome back to your Pediatric Dentist channel Tiny Teeth Talks. If you are new to this channel, subscribe the channel, and for details of this channel visit the bio section, or you can also check out my first video. There are some problems occur during eruption process during teething and can cause discomfort or complications for infants and young children. So let's see what are the problems occur during teething. First is eruption hematoma. An eruption hematoma is a variation of an eruption cyst that occurs when minor trauma or bleeding accumulates within the cystic space. So basically, eruption cyst forms in the soft tissue overlaying on erupting tooth. Fluid accumulates between enamel epithelium and oral mucosa. A bluish purple elevated area of tissue occasionally develops few weeks before the eruption of primary or permanent tooth. The blood-filled cyst is most frequently seen in the primary second molar or the first permanent molar regions. Coming to the etiology, it may be due to the accumulation of the blood in the follicular space of an erupting tooth. Trauma or infection may contribute to hematoma formation. Space deficiency in the dental arch can delay eruption and leads to hematoma formation. Clinical features appears as a soft dome-shaped swelling over an erupting tooth. Color varies from bluish to purple depending on the extent of bleeding, usually painless but may cause mild discomfort if inflamed, resolves spontaneously as the tooth erupts. Management observation. Most cases resolve naturally without intervention. If the hematoma persists or interferes with the eruption, a small incision may be made to expose the tooth, which is surgical excision. Pain management, analgesics may be prescribed if discomfort occurs. Second is eruption sequestrum. An eruption sequestrum is a small fragment of necrotic bone that is shed during the eruption of the permanent molars, particularly in the children. It is typically found in the gingival tissue overlaying the erupting tooth and is considered a benign condition. Etiology results from localized bone necrosis due to the pressure exerted by the erupting tooth may be associated with inflammation or trauma during the eruption process. Clinical features appears as a small whitish fragment of the hard tissue in the gingiva overlaying the erupting tooth, commonly associated with mandibular first permanent molars, may cause mild discomfort or gingival irritation but is often asymptomatic. Histopathology composed of necrotic cortical bone may show sign of chronic inflammation in the surrounding gingival tissue. Management observation. In most cases, the sequestrum is naturally expelled during tooth eruption. Surgical removal. If fragment causes discomfort or delay eruption, it can be excised under local anesthesia. Pain management analgesics may be prescribed if necessary. Third is ectopic eruption. Ectopic eruption refers to the abnormal positioning or path of a tooth during its eruption process. Basically, the tooth is not at the place it should be. This condition is commonly observed in pediatric dentistry due to the replacement of teeth leads to the misalignment or abnormal eruption path plus space discrepancies plus some teeth have complex eruption paths or position and can lead to complications such as a malocclusion, crowding or impaction. Etiology, local factors, space deficiency, premature loss of the primary teeth or abnormal tooth jump positioning. Systemic factors, genetic predisposition, developmental disorders or hormonal imbalances. Environmental factors, trauma or infection affecting the eruption pathway. Commonly affected teeth is maxillary first permanent molars, most frequently affected with the prevalence of 2 to 6%. Maxillary canines, second most common with the prevalence of 1.5 to 4.6%. Mandibular molars rarely affected but can present unique challenges. Clinical features, delay eruption or partial appearance of the crown. Changes in the eruption axis such as a mesial angulation. Associated symptoms like gingival swelling or discomfort. Management observation. Mild cases may self-correct as the dentition develops. Appliances like Halterman devices or distalizing springs can guide the tooth into proper alignment. Surgical intervention. In severe cases, surgical exposure or extraction may be required. Preventive measures, early diagnosis, and space management can minimize the complications. Fourth is non-eruption of teeth. The non-eruption of teeth refers to the failure of a tooth to emerge into the oral cavity within the expected time frame. This condition can affect both primary and permanent dentition and may lead to complications such as the malocclusion, crowding, and impaction. Local factors: space deficiency, ankylosis of primary teeth, or obstruction by supernumerary teeth. Systemic factors: genetic disorders, endocrine abnormalities, or nutritional deficiency. Environmental factors: trauma, infection, or radiation exposure affecting the eruption pathway. Clinical features: delay or absence of eruption of teeth. Associated symptoms may include gingival swelling, discomfort, or changes in the dental arch. Radiographic findings may show impacted teeth or abnormal positioning. Management: observation: mild cases may resolve naturally as the dentition develops. Orthodontic interventions: appliances can be used to guide the tooth into proper alignment. Surgical interventions: exposure or extraction may be required for impacted teeth. Preventive measures, early diagnosis, and space management can minimize complications. These are the references. In next part, we will cover the fifth one, which is natal and neonatal teeth, also included in teething abnormalities, but most important question for exams and clinicals and viva everything. Till then, if you want these as PDF or any other PDF, just like, subscribe, and comment your mail ID with the topic, and I'll send you the PDF. New videos on Sundays for now. Also, we will put lots of important things on shorts, so subscribe and press the bell icon for that. Like, share, and subscribe. Thank you.